Hello, my name is Donald Frazier. I'm the Chief Executive Officer with Building Opportunities for Self-Sufficiency, also known as BOSS. Since the onset of the COVID-19 pandemic, our commitment has been unwavering in educating and providing essential resources to Black communities across Alameda County, especially in Oakland. Today, through this video, we are proud to showcase the incredible work carried out by our dedicated partners. Our collaborative efforts have focused on 3 key zip codes in Oakland: 94603 in Deep East, 94621 in Central East, and 94607 in West Oakland. With the support of 10 remarkable community organizations, including Adamika Village, Realize Potential, Owning My Own Truth, Serenity House, Mercer Brotherhood, Sushi, Men of Influence, GCEA, we have been able to make substantial strides in health promotion and education. These groups are the backbone of our outreach, diligently working to ensure our communities are not only informed, but are also actively engaged in combating this pandemic. From distributing flyers and facilitating vaccination clinics to hosting community events and leading social media campaigns, our partners have been instrumental. This video will take you through our events and hear directly from the community about the difference these initiatives are making. You will see firsthand how resilience is built, one educational step at a time, and how BOSS, along with our partners, continues to champion the health and well-being of our communities. As we continue to navigate through the challenges posed by this pandemic, it's crucial to remember that every step toward community health is a step toward a stronger community. At BOSS, our resolve remains firm. We're more than just participants in this battle against COVID-19. We are leaders committed to empowering and uplifting every member of our community through education, outreach, and direct action. Together, we're not just facing challenges, we're transforming them into pathways for health and resilience. Thank you for joining us, and let's continue to work together to foster a healthier, more resilient Oakland.
The COVID-19 pandemic severely impacted underserved communities, especially Black and African Americans in Alameda County. In 2021, only 59% of Black residents had received at least one vaccine dose, reflecting healthcare access disparities and vaccine reluctancy. A survey by BOSS and community partners revealed that distrust in the government and healthcare system was a primary barrier, particularly in zip code 94612, where 48% of respondents did not plan to vaccinate. To address these issues, BOSS, with the Alameda County Public Health Department, launched an outreach initiative focused on health literacy and vaccine access. By 2024, vaccination rates rose to 69.3% among Black residents, with notable improvements in zip codes 94621, 94603, and 94607. Follow-up surveys showed that 86% of participants found BOSS's resources useful, and 98% knew where to access COVID-19 services. This success illustrates the power of culturally sensitive outreach in reducing health disparities, fostering trust, and empowering communities. BOSS's work underscores the importance of partnerships between public health agencies and community organizations to address healthcare inequities effectively.
So we're out here tonight to enjoy this event, connecting a lot of different organizations in the nonprofit world on helping the community and exposing us to all types of different healthy aspects about living in our community.
Well, at GCA, we help with the community of providing services for, immigrants and just citizens here. The events that we do it helps the community a lot. They come here and they're pleased with the information and help that they get.
So this is just a way that that Oaklanders can just come together and share with one another and learn about what's happening around us.
Current perspective is it's really bad. Everybody is like getting locked in, bunched up together, and having to go back. People are starting to go back into their houses.
It looks like as if it's not around, and with all the information that we received today, we learned that COVID is still alive and well. We must still protect ourselves.
I'm going after the information because I know that I'm an older individual and a lot of things affect me, and I want to make sure that I know what's going on with me and the community around me.
From my experience, I worked in San Francisco for a period of time where COVID was very widespread. We had to keep ourselves safe. We had to have injections, so that we would not be carriers of the disease, COVID.
My family hasn't been as big, thank God for it, but I know many friends and many families who people have died away and held funerals, and it's just such a depressing situation.
Yes, my family has been affected by COVID. I lost 3 family members at the same time.
Wow.
I lost a father, a daughter, and a grandson.
There's a lot of places in the community that have like free COVID vaccine shots, there's a lot of stuff, and I think it's very helpful, especially for like our homeless population and people who don't have like medical help. I think it's very helpful that we have organizations that have other opportunities where you could go get a COVID test, where you could get a COVID vaccination.
I think the COVID-19 pandemic opened up a line of communication that the community did not previously have. We tend to lack on our health concerns. So these type of events allows folks to come in and get all the services they need at one time.
I thank God for the resources and the hospitals around Oakland and all the Bay Area, and the COVID screening and the shots really helped, and I feel that it helped the world in general.
I believe that the most important resource that we have available here are the medical packs with the tests and the masks and the sanitizing, because again, a lot of these things aren't offered for free at most places, and it has raised in price due to COVID becoming a much larger issue during these times.
This COVID event brought out the community. That's what I like. That's the biggest resource, because it gives people a chance to network and access different resources that they didn't have an opportunity to access.
As you guys see, I am pregnant, so being able to just come out of church and get my blood pressure checked and have other people in the community be able to just have that resource here just very close I think is amazing.
Basically just having these events more often and reaching out to as many people as we can, because we do not want to fall back into COVID. That was a disastrous time for us as a society.
Have more events like this, maybe have a doctor on hand that can explain COVID to people that don't know anything about it, or they can further explain for the things that you guys don't know about it.
I just really didn't even know it was still around. I'm sorry.
That's why we're out here doing this, because we want to make sure everybody is educated about COVID-19.
So instead of waiting for times like this to have information, maybe there should just be information at grocery stores, malls, schools, things like that.
What we have to do, we have to open our mouths. If we open our mouths, then people will know. If we be quiet, people will never know. They think COVID is gone, and COVID is not gone.
I think community coming together and we can share information, the resources, because a lot of times we're not connected with all the possible resources. So more fairs like this really would be nice, that we could come together.
I think resources that would help me further my business and help me with my business would be like government grants,
resources to help me probably go back to like business school or something, so I can get more information and set my business up, or a grant from the government to like maybe secure a storefront. I know a lot of people lost their businesses during COVID, so they need a lot of resources and grants to help those people get back out there since the economy is back to normal, I guess.
People cannot get a job. Like the way it was before COVID and after COVID is different. So we need to really work, support our community in COVID recovery, because very much still we are in that situation. Even though COVID is over, people are back to work, and there's a lot of stuff need to be addressed in the population that we serve.
Any last words?
I appreciate everybody, like BOSS and other partner organizations, OFH, which is 27 organizations that we come together to support our community. So we need to continue the work that we're doing, and that's what I wanted to say. Our partnership should be stronger and serve the community together.